Hello, everyone. Thank you so much for joining our webinar today. My name is Courtney Vivi, and I'm the VP of Marketing here at Ezderm. Today, we're going to talk about all things MIPS in 2024. And I just first want to say thank you to our partners at Healthmonix for joining us. They are truly the MIPS macro experts, so we're very excited to have them with us. Our presenters today are Mara Flaherty, who is a MIPS specialist at Healthmonix. And on the Ezderm side, we have Erica De La Garza, who is an implementation and training manager, as well as Mandy Waters, who is our client success manager. We are going to talk about understanding MIPS, the direction of MIPS, and the Ezderm and MIPS Pro partnership. But before I turn things over to our presenters, I want to go over a couple of items. First, if you have any questions during the webinar, please submit them to us using the chat feature, and we will do our best to answer your questions at the end of the webinar. And second, I will be emailing out the recording of the session and a PDF of the slides to all registrants after the webinar is over. So if you have to jump early, no worries, you'll still be able to finish what you missed and share it with anyone who might find it useful. So with that, I'm going to turn things over to Mara.
Thanks, Courtney, and thank you for organizing the webinar. Really looking forward to reviewing MIPS and the partnership and how we can help folks out. So getting started, we're going to go over pretty high level, just a refresher on the MIPS program. So you can go to the next slide. If you've reported MIPS before, or if you're pretty familiar with it, this will all be review, but still good info to have going forward, just to keep up to date on all things MIPS. So the program began back in 2017. There have been a couple changes, different iterations over the years. If you're familiar with the term MACRA, very closely related to MIPS, that's really the overarching legislation that has brought MIPS into play. And what it does is mandating payment adjustments to providers who care for Medicare patients. So it's related directly to quality and cost of care. What it's doing is paying providers or incentivizing providers to provide high quality care that is also cost efficient. There are two payment tracks in MACRA, or the quality payment program, one of which is MIPS, which we're going to focus on heavily today, and then the other one would be APMs, or advanced alternative payment models. So another just overview of what MIPS is and why it was developed. Again, it was designed to tie payments to quality and cost efficiency, and then all the while improving care that providers are providing to their patients. It gives us a way to really track the quality and hold groups and providers accountable for the quality of care, and then the cost as well. So why should groups participate in MIPS? The first thing is going to be that a lot of groups are required to report in MIPS. I'll get into it on the next slide, but there are certain thresholds tied to the volume of Medicare that a provider sees that will dictate whether they are required to report or not. And then I mentioned there's a very distinct financial piece of it, wherein high performers in the MIPS program are being incentivized or paid out. And then on the flip side, low performers are penalized. And then the last thing is just, again, it's a great way to track the quality of the care that you're providing outside of payments or incentives, anything like that. The ultimate goal really is providing high quality care. So those are just broad overviews of where we're coming from in terms of encouraging folks to participate in the MIPS program. So MIPS eligibility, just mentioned, these are the thresholds for where a provider is required to report. So it says your eligibility status determines whether you'll receive a MIPS payment adjustment. So if you're required to report as an individual provider, you will receive a payment adjustment. It's just going to be a matter of whether that is a positive incentive payment or a negative penalty. So the 3 criteria listed here, these are on an individual NPI basis for the year. So if a provider is billing more than $90,000 in Medicare Part B and seeing over 200 Part B patients and providing over 200 covered professional services, that provider would be required to participate in the MIPS program. Key distinction here, they have to have met all 3 of those criteria. If they meet 2 or fewer, that would categorize them as opt-in eligible, but not necessarily required as an individual. So if a provider is required, they would need to sign up, register to report MIPS, track their quality, and then submit to CMS at the end of the year. If they don't submit anything, then they would receive a penalty based on percentage of the Medicare that they bill throughout the year. So again, with the financial impact, it's the idea of the program is that it's budget neutral for CMS. So in theory, the low performers are actually paying out the high performers, which is why it's important to pay attention to MIPS and score and perform as well as you can so that you're not receiving the negative penalties. And MIPS has gotten more and more difficult each year since it started in 2017. So we have many groups come to us that aren't necessarily looking to score a perfect score, but the more points you can get, you can at least minimize the penalty. And this looks different for every group and every client that we have. Some are looking to just avoid the penalty altogether. Everyone has different goals in terms of where they hope to fall in the financial aspect, but we help our clients at least get to where they'd like to be throughout the year. So the payment adjustment factors, this is a visual representation of where you would fall on the payment scale based on your final MIPS score for 2024. So the number to avoid a penalty and receive a neutral payment adjustment for this year is 75 points. It's been that for the past few years, and no sign that that's going to change for next year. So if you score exactly at a 75, you would receive neutral. So you wouldn't be incentivized, you wouldn't be paid out, but you're also not going to be penalized, and that's half the battle. And then you can see it's a sliding scale up to 100 and then down to 0, where anywhere from 0 to about 18 and a half, you'll be receiving the full amount of the negative penalty. And then if you can score between the 18 and a half through 75, that penalty is minimized the higher your score is. So that's why I mentioned it's a strategy to at least score as many points as you can, even if you're not avoiding the penalty altogether. It can be really beneficial and valuable to at least minimize the damage in terms of the financial repercussions. So again, mentioned that there have been lots of changes to the MIPS program. So I wanted to just go over the direction of where it's been and where it's going. CMS has a pretty clear vision on where they hope to see the program in the next few years, and it will definitely look a lot different. So mentioned previously that MIPS started in 2017. There was a bit of a ramp up period where they weren't necessarily requiring full reporting for all providers. 2019 was really the first year that it was in full gear for reporting for everyone, all patients and providers. And then obviously in 2020, COVID hit, and those exemptions lasted longer than anticipated all the way through. 2022 was automatic, and then in 2023, a lot of groups could apply and get the COVID exemption. And that was all on the MIPS side. In 2024, we're seeing it back at full reporting. Everyone needs to report. There's no more COVID exemption, and it's really back in full gear. So that's MIPS. And then there's also the new addition of MVPs, which is really the direction that we see CMS trending towards. This year, 2024, is the first year that MVPs are a reporting option, and I'll get into a little bit more of the timeline on that on the next slide. But that's this year. And then on the ACO side, last year was a transition year for ACOs. This year is another transition year, but same idea, CMS is ramping that up, and we expect to see that in full gear over the next year or two. So what is the MVP reporting option? Like I mentioned, 2024 is the first year that this is available. It's an alternative to traditional MIPS. So providers that have been reporting MIPS are required to report MIPS. You can report an MVP instead of traditional MIPS, and that would count for your requirements. So the idea is that MVPs are more focused around specific specialty or condition. There are different requirements on how many measures need to be reported for each of the categories. So for example, in quality, you need to report 6 measures in traditional MIPS, but through the MVP, CMS is only requiring 4 measures. There will be a smaller subset of measures available within each MVP, but again, they're all focused around the idea is to be more clinically relevant to specialty providers. So this year in 2024, there are 16 MVPs available, and then there are a handful more that have been proposed for the 2025 performance year. And obviously the one I want to highlight is the dermatological care. So there's a large population of dermatologists, obviously, in the country that have not had the MVP reporting option, but it is proposed in the proposed rule for next year, and we should see that finalized within the next month or so on whether that MVP will be included in reporting for 2025. So timeline from where we are to where CMS plans to go, really focused around MVP reporting. So 2023, first year that it was even an option. 2024 is where we are. We've added some MVPs even from last year. 2025, like I just mentioned, there's I believe 6 MVPs that have been proposed to add. In 2026, subgroups, which are a way of reporting and breaking down a provider practice for MVP reporting, mostly based around subspecialties. But that will be mandated in 2026 for groups who choose to report an MVP. And then all the way to the right, you can see not set in stone on specific years, but CMS has made it pretty clear that their goal is to sunset traditional MIPS and make MVP reporting mandatory. And there's work that needs to be done by CMS and by practices to make that a reality, but they've made it very clear that that is their goal. So MIPS will most likely be going away, and MVPs are the future. So broadly, these are some of the objectives CMS has given for the MIPS program. First thing, promote more meaningful participation for clinics and ensuring policies continue to drive toward value and improved health outcomes for patients. So the main goal of this whole program, like I had mentioned, is quality of care and health outcomes. So they're not losing sight of that that image and that goal. And then the next 2 points, the way that that is being brought into light is through MVPs and APMs, less so with the traditional MIPS route, and more to the alternative payment models. And then the last bullet is something CMS has been focusing on a lot, is just health equity, social determinants of health, and other factors outside of the standard care that we're providing. So a little bit about Ezderm and our partnership, Ezderm and Healthmonix. So Healthmonix, taking a step back, we are really a data analytics company. A lot of people will know us primarily as a MIPS registry. That's really been our core business, but we do participate and help clients in provider practices in a lot of other ways through other payment models such as the APP, which is ACO reporting, now MVPs. We do have MIPS cost tools, excuse me, that a lot of groups are taking advantage of. It's really big in dermatology as well. But that's really who we are. We work with a lot of groups, like I had mentioned, on avoiding the penalty. We've seen great results in terms of numbers of penalties avoided and then incentive payments that we've been able to help our clients achieve. And we're very proud of those numbers and success in that area. So our partnership, Healthmonix and Ezderm have been partners since the very beginning of MIPS, so 2017. And believe it or not, the partnership has grown every single year since then, which is very unusual, especially given the terrain of the MIPS program with COVID declining. A lot of reporters, opted out, but every single year since 2017, our partnership was grown. So that's something we're really proud of and look forward to growing it even further. And just for an example, in 2023, we had Ezderm and Healthmonix had over 150 mutual clients, and that's separate practices. So, that number in providers is even higher than that. So what our partnership really looks like, we've teamed up and our main goal is really to alleviate some of the administrative burden of MIPS. So we have Ezderm and Healthmonix have a direct API integration between the EHR and MIPS Pro, which is our registry product. So that data coming out of Ezderm will come over automatically on a very regular cadence. It's about an hourly update. So the dashboards that you'll see in MIPS Pro tracking your quality measures are real time, they're live dashboards. And that we've seen is just a huge advantage for providers who are looking to report MIPS. We have plenty of groups that come to us every year outside of partnerships and integrations who upload data to us. And the advantage that we've seen of the integration that we have with Ezderm has been really influential, and we've seen a lot of success. And then again, just reiterating, we helped our clients earn $200 million in incentives in 2022, all through the MIPS program. All right, and I'm going to turn it over to Erica to talk about the Ezderm side.
Thank you, Mara. So here at Ezderm, we understand that MIPS reporting can be both complex and time-consuming, especially with the unique requirements in dermatology. That's why we've partnered with Healthmonix to offer a comprehensive solution that simplifies and streamlines your reporting process. With our platform handling all your MIPS reporting, you can easily simplify MIPS reporting. Our system supports all the essential quality measures specifically tailored for dermatology, so you can focus on what matters most, patient care. We manage all MIPS categories. Our integrated platform allows you to manage quality, PI, improvement activities, and costs all in one place. No more jumping between systems or spending hours compiling reports. By utilizing Ezderm for MIPS reporting, you not only save time, but also ensure that you're capturing and submitting the correct data for maximum incentive potential. We help make sure you meet CMS requirements, improve your reporting accuracy, and ultimately drive better performance in MIPS. Ezderm simplifies the process of MIPS reporting, offering support for a set of quality measures that are most relevant to dermatology practices. When using our platform, you'll be required to report on 6 measures, with at least one being a high priority or outcome measure. To meet CMS requirements, you'll need 20 eligible instances for reporting, and a 75% reporting rate must be maintained. With Ezderm, we ensure that reporting is again streamlined, helping you easily meet these requirements while focusing on providing the best care for your patients. Our solution takes the complexity out of MIPS reporting, allowing you to remain compliant without added stress. At Ezderm, we understand how crucial it is for practices to stay compliant while reducing the risk of penalties. That's why our software is designed to help your practice meet MIPS reporting requirements effortlessly. Our platform identifies missing or incomplete measures, allowing you to address any gaps quickly and stay ahead of the deadlines. We keep pace with the latest CMS updates and MIPS regulations, so you can feel confident your reporting is always accurate and up to date. Ezderm also allows you to run reports in real time for quality measures, helping you address any incomplete measures efficiently. As an implementation manager, I recommend that all of my offices run these reports monthly to catch gaps early and avoid the stress of piling all the work at the end of the year. By using Ezderm, you'll minimize the risk of penalties while maintaining a high standard of care, all without worrying about compliance issues. Plus, with our interface, you can easily review incomplete visits and make sure your reporting rate stays above the required threshold. At Ezderm, we go beyond just offering a platform for MIPS reporting. We carefully research and select each quality measure to help you not only stay compliant, but also maximize your MIPS performance. Our system supports 9 carefully curated quality measures, specifically chosen for their relevance to dermatology and their potential impact on your MIPS score. These measures include a mix of high priority measures, such as Care Plan Measure 47, a high priority measure designed to ensure comprehensive patient care plans are in place. Melanoma Recall System, another high priority measure focused on improving follow-up for melanoma patients. Closing the referral loop, Measure 374, a crucial measure to ensure proper communication between specialists and PCP providers. We've also included outcome measures like psoriasis, clinical response to biologic medications to track patient progress and care quality. By using Ezderm's platform, again, you can easily manage all these measures all in one place and ensure that your MIPS reporting is optimized for maximum performance. Ezderm continues to evolve to meet the ever-changing MIPS requirements, and we are excited to introduce our new measures with a 5-point floor for 2024. This means that when you meet the reporting rate and eligible instances, you automatically receive 5 points for these measures, regardless of the performance rate. This ensures that your efforts to report on these measures are rewarded, even in cases where performance may vary. The new measures include 485 psoriasis improvement in patient-reported itch severity, 486 dermatitis improvement in patient-reported itch severity, and 487 screening for social drivers of health. As an implementation manager, I frequently receive calls asking, "Hey Erica, screening for social drivers of health isn't part of dermatology. Why was this measure chosen, and how can we incorporate it into our workflow?" I always explain that this measure was selected because of the 5-point floor, making it an easy way to gain points regardless of performance. Medicare outlines this as a screening, not an in-depth questionnaire. Your medical assistant can simply ask patients a few questions like, do you feel safe at home? Do you have reliable transportation? Do you have enough to eat? There's no need to give patients a formal handout unless they answer yes to any of these questions. In that case, you can provide a handout with information on local health departments or relevant resources within the state. I've also worked with offices that encounter patients who may resist these questions. To help them, we've provided scripts that the clinical staff can use, such as, These are government regulated questions that we are required to ask for compliance purposes because we accept insurance. We apologize for any inconvenience this may cause you. These are just some of the practical tools our trainers offer during the onboarding process. We partner with Healthmonix because they are the macro experts. However, our trainers bring years of in-clinic experience and understand how to seamlessly integrate these workflows into your daily practice. You don't need to be a MIPS expert to succeed. Both Ezderm and Healthmonix provide enhanced support and guidance to make MIPS reporting easy and effective for your practice. Our platform offers quick and reliable assistance from both the Ezderm and Healthmonix teams, whether you need troubleshooting help or guidance for accurate data submission. We are here to support you every step of the way. In addition, you'll have access to tips and resources through the Ezderm support portal. This portal is designed to help you optimize your performance on key measures, ensuring you meet CMS requirements while maintaining the highest standards of care. By leveraging the tools and resources we provide, you can focus on what matters more, patient care, while staying compliant and maximizing your MIPS performance. And with this, I'll turn it back over to Mara.
Sounds good. Thanks, Erica. So just getting a little bit more into the specifics of MIPS Pro and how we can help you specifically through our partnership and integration with Ezderm. So once you get your MIPS Pro account set up and you get your Ezderm data flowing over through the integration, we provide analytics tools to help you improve your decision making in terms of where you should be spending your time and efforts on measures. So we'll show you your gaps in care and show you which patients and visits are counting as not met and incomplete instances so that you can go back, make those updates, and improve your performance. We report on all MIPS categories. So we do quality improvement activities and promoting interoperability. And then I mentioned earlier, we have a MIPS cost analytics tool as well, where we're ordering claims directly from CMS to build out into a dashboard, similar like we do for quality. The submission piece is a big part of it, and so we will send your data directly to CMS. All you need to do is log in, review your performance, your data, hit submit, and we're sending everything on your behalf. So you don't need to log into QPP. We're taking care of that piece directly for you. We have a full US-based support team. None of our data goes offshore. None of our employees are offshore. Everything is US-based. And again, our team is experts in the MIPS field, so we'll be able to help you out with any questions you have about the program or product at any point throughout the year. So year-round reporting, you'll be tracking your data in Ezderm and documenting appropriately. And then we'll get your data through the integration, and that will backfill through, no matter what time in the year you get set up with us, we'll backfill the whole year's worth of data so that you can see performance and report appropriately. And then integrating your data. So if you were to come and go live with Ezderm in the middle of the year, we do have the ability to combine data sets. So you could take your legacy EHR data, combine that. Our team would walk you through and help with the data combination process so that we can submit one data set accurately and appropriately for you for the reporting period. So just, excuse me, quickly, this is our main quality dashboard, measure dashboard. So you can see the measures selected in the demo account are not the dermatology specific measures, but you would be able to track all 9 of those measures that Ezderm supports. And then we'll show you performance on all of them adjusted for deciles. And then you can filter this by NPI as well and see a provider's performance across all measures. But just to give you a feel of what the product looks like, this is our main dashboard there. And so when you do go through the submission process, this is our quality points page. We will, like Erica mentioned, there are certain thresholds that need to be met to stay compliant. That's going to be 20 eligible instances for each measure and a completion threshold of 75%. So this page is filtering through all the measures that a group is tracking, and it's going to show the top 6 measures, taking those 2 compliance features into account. And so we'll make recommendations, and our team can help with this as well. But as you go through the year and track your quality measures, this is something that you'll want to take a look at to ensure that even if you have good performance, that you're meeting the requirements in terms of instances and completion threshold. So again, we would recommend reviewing this page, selecting the measures you want to send to CMS, and then it's really just a click of a button to actually send your data over to them. All right, and I'm going to turn it back to Ezderm.
All right, thank you so much, Mara. That was a wonderful and informative presentation from Erica and Mara. Really appreciate all of the details that you shared. So as we come to a close, I'd like to go through kind of where we go from here. Getting started with Ezderm. So for those of you who are not yet existing clients of ours, we'd love to offer you a complimentary demonstration of our system as a whole. So as you can see on your screen here, there is a hyperlink that you'll be able to access once we send out the deck for you, but also feel free to use this QR code, which will direct you right to a form that you can fill out, at which point one of our account representatives would receive that and reach out to you to schedule a demonstration. They'll be able to go over the entire system with you. As well, they will be able to go into more detail regarding MIPS that we discussed today, and the partnership with Healthmonix. So feel free to go ahead and get that scheduled. Otherwise, if you would like to discuss anything further as an existing client, please feel free to reach out to our customer success team or our customer support as well. And we'd be happy to address any questions that you may have as an existing client. With that said, we'll go ahead and go over to the next slide where Mara will discuss what you can do to get started with Healthmonix.
Yep, thanks, Mandy. So the registration process for Healthmonix is really pretty easy. Our platform is fully online, cloud-based platform. So you would just go out to the URL we have listed here, create an account with us. It's just an email and password to get started. And then I listed down here all of our product options. They vary based on which of the MIPS categories you want to report. So they're listed out here, but certainly feel free to reach out to our sales team, and we're more than happy to walk you through the process of getting started, purchasing licenses and all of that. But this is where you would go to do it, ezderm.mips.healthmonix.com, and these prices listed are reflect a discount that we have through our Ezderm partnership.
All right, perfect. So if there are any questions that you'd like to reach out to us following this presentation, please feel free. As Mara mentioned, you can reach out to Healthmonix Sales. Also, her contact information is listed here with her email and her phone number. If there are any questions regarding our sales on the Ezderm side, please feel free to reach out to our VP of Sales, Otis Nelson. His email address is listed as well. Like I said, you'll get a copy of this, so you'll be able to see the contact information easily there. And then again, for our current Ezderm customers, any questions that may come up, please feel free to reach out to customer success at ezderm.com. And with that said, we'd like to open up the floor for some Q&A since we do have a little bit of time left. So I do see that a couple of questions have come into the chat. If anybody else has questions, please feel free to submit them in the chat box you can see on your go-to. So let me go ahead and pull these up and I will direct the question to the appropriate person. So first question here that came in, as an Ezderm user, when should I engage with Healthmonix? So I believe, Erica, you can take that question.
Sure. So they can actually reach out to Healthmonix. You know, we've gotten users that reach out to them as soon as maybe like June comes around. These are for kind of those people that like to get the ball rolling. So as soon as June comes around, even sooner, you're kind of free to kind of reach out to them.
Awesome. Thank you so much, Erica. All right, next question that came in. How well do the measures cover my reporting needs? So I think, Mara, this one might go to you.
Yeah, absolutely. So Erica had mentioned in her presentation the 9 measures that Ezderm supports for MIPS reporting. So those are all dermatology specific and should fit very well to the work that you're already doing in your practices. So those 9 measures will cover really everything that you'll need. And we, Ezderm and Healthmonix, work together on a yearly basis to kind of reset and determine which measures should be supported. So those are the ones that we've found apply most closely to the work that you all are doing.
Perfect. Thank you, Mara. Next question. What measures are specific for dermatology? I think you guys kind of covered this, so it may have come in before you covered that, but we'll go over it one more time.
Yeah, I can take that. So similar answer, I would say refer to the measures that were listed in the presentation. CMS also has listings of all of their CQM measures, and they do section them out by specialty. So for a comprehensive look of how they compare to other measures, you can always feel free to take a look at the CMS QPP site. But I think folks will find that they align pretty closely with the measures that Ezderm supports for MIPS.
Perfect, thank you. Last question that I see for now is customer support, who do I contact? So I'll take that. So for the Ezderm side, of course, as an existing Ezderm customer, we do have our tech support that's available at all times, as well as our customer success team that's available to you. So you can feel free to reach us either at our portal, the tech support portal, or by our email addresses that you have available to you to reach our support teams at any given time. And then Mara, for your side, I know you touched on this a little bit earlier, but if you could just one more time reiterate the support side for Healthmonix.
Yeah, absolutely. So when you get set up with us, you'll get all the information of our support offerings and what it looks like. But basically, our support team is available by phone call, email, and then they also have a live chat feature within the product, which is an effective way to get in touch with them. But yeah, if any questions come up, they're available all year long for product support, MIPS questions, anything really on the Healthmonix side that we can help you with.
Awesome. All right. I think that covers all of the questions that we have that came into the queue. So with that, thank you all so much. And Courtney, I'll pass it back to you to close up.
All right, well, thank you so much for everyone who attended. I will be sending this out within 24 hours after the webinar is over, so you'll get all the content from the slides and you can rewatch the video. Thank you so much for joining, and everyone have a great day.